to have you join us today for our Project Scope series. Once again, we are recording these sessions. They will be on our website and on our Canvas. So by joining this session, you are consenting to be recorded. Just another example of just changing your name so that we can know who is attending, as well as it helps our presenter know who is joining ours. We are a community of practice. We're hoping that this is interactive, so please make sure that you have your cameras on. If there are questions, put those in the chats, provide that feedback on that. The other thing that our ECHO sessions do is we have case narratives. They are a great way to gain information from our colleagues, as well as just a way to learn more and help the clients and the families that we serve. So if you have a case that you are interested in, please reach out to us. That would be amazing. When we're talking today or anytime in the future, if you can avoid using any information that would identify an individual. So first names, last names, coworkers, where they live, we want to make sure that we maintain privacy. The key components of an ECHO session are just to spread that wealth of information. So we will always have a didactic speaker as well as a case presentation. As we're listening today, or as anytime in this next sessions, if you would think about one reflection from the session and one thing you might add to practice and put that into the chat. It helps us as the hub team know where we should move forward on anything. Always pre-registering for the ECHO sessions ahead of time is always helpful. We did realize today that we have a limit of how many people could register, so that might be a why some of you had some struggles today. Our limit is 100. So we have 100 people registered, and we're going to look into that in the future. To receive a credit of attendance, there will be a survey after today's session. Fill those out, and that's how you'll get the certificate of attendance. I'm going to turn it over to Jared for a minute to talk about the CMUs.
Thanks, Janelle. So momentarily, I will place in the Zoom chat the CME code for today. A reminder that anybody who attends this session will receive an email with instructions on how to claim CME. Please claim that CME credit today. That code expires at midnight. Now, if you're here for nursing contact hours or another kind of hours, we do encourage you to claim CME and utilize those. Those are valid basically across the board for your certification, licensure, privileging, whatever else. Most credentialing boards do accept CME certificates or any of the credit offered from the CME office. So we are working on getting CEUs specifically from the nursing school, but for now, please use the CME certificate, and that will be valid basically anywhere except Nevada, from what we found, for the purpose of your certification. So again, nursing hours, please claim CME until further notice. Thank you.
Great. We also have our Canvas and REDCap. So Canvas is where we store all of our information. So the PowerPoints, any resources that are shared within the breakout groups or from our presenters. So if you do not have access to the Canvas, please reach out to us and we will get that for you. REDCap is where the survey will come through. It sometimes comes to your junk email. So please take a minute and complete that survey for us. Case studies, always doing the plug for that. It's a great way to hear information from your colleagues about recommendations, learn about new resources. I know it's not always the funnest to present or share about a case, but it is a great way to learn from each other. Just letting you know that we have a project scope and an Instagram account. So if you have not followed us on social media, take a minute to do so. We share information about our sessions as well as future information. I'm just really excited today to introduce Katelyn. We had her present at our last session, and she just does an amazing job about teaching critical conversations with compassion. I just love hearing about this. So I'm going to stop talking and let Katelyn take over.
Thanks, Janelle. Let me get everything set up really quickly. Okay. And thanks so much for Project Scope and the Institute for Disability Research Policy and Practice at Utah State University for having me again. I know that the Project Scope team has worked really hard to develop compelling presentations for this cohort, and yeah, I appreciate being invited back. Just to tell you a little bit about myself, I received my MSW from the University of Southern California. I currently am an operations manager at Utah State University here at the Sorensen Center. I have definitely learned a lot of therapeutic modalities and have brought those into my managerial role. And I want you all to know that prior to going through a lot of training around having crucial conversations, I avoided them like the plague. They just made me really uncomfortable. But I am definitely a testament and am here to say that it is completely normal to feel uncomfortable in when having difficult conversations. But just with anything, just with practice, you start finding a little bit more comfort. I'm not saying that they'll be stress-free, but you just can find confidence within yourself to be able to engage into the conversations more deeply and authentically. So I'm wondering, I want to see the chat. I'm wondering if you all, I have it up now, if you all could kind of share in chat, what are your thoughts around difficult conversations? How do they make you feel? And I'm not sure.
Katelyn, if you want me and Kurt to monitor chat too, we can do that, but people can also unmute if you are comfortable in unmuting and answering Katelyn's question.
I'm totally fine with that if others are. Well, let me tell you, when I originally, someone asked me this like many years ago, and as I was describing difficult conversations, I used an analogy of feeling like I was drowning. And so that's pretty dramatic, but I think that's how out of control I felt when having difficult conversations. Yeah, Mindy's saying she gets some fight or flight feelings. That's definitely something that I can relate to. And being nervous, Barbara says, and anticipating the worst. Yes, catastrophizing for sure. So I think that these are really, really hard. I mean, we get really strong emotions around having difficult conversations, and hopefully I can teach a few of the tools I use to help self-regulate and prepare and have those difficult conversations more successfully. So some of the learning objectives for today, learn what a difficult conversation is, kind of what the criteria is around it, why do we even want to have difficult conversations? Why put ourselves through this misery? And how to prepare for those difficult conversations. And once you've prepared, actually having them and then learning from them through the reflection process. So a difficult conversation is between multiple people when the stakes are high, opinions vary, and emotions run strong. And I think that that's why we get some of these items in the chat, such as it feeling exhausting and feeling nerves. It can be very intense. So I want you to think about a difficult conversation that you've been putting off or you recently had and it didn't go your way. And reflect on this as we're having, as I'm going through this presentation. So I'm going to use, I'm going to share an example with you all. And one of my difficult conversations I need to have in the near future is a conversation with communication between my brothers and I. We have this lofty idea of starting a side, a business together. And so far I'm not happy with how the communication's going around it. I want everyone to realize that difficult conversations it's subjective. So what I find to be difficult, you may not find to be difficult, and vice versa. And there's also clearly different levels of difficulty. Stakes can be super high, as this definition suggests. So my next question is why do we even have these difficult conversations? Does anyone, you can unmute yourself if you'd like, or you could share in chat why you would even want to have a difficult conversation. So I'm gonna just jump over and maybe help you out. So one of the reasons why we have difficult conversations is to demonstrate that I care. Demonstrate that I care about this value, this ideology, this relationship so much that I'm willing to be uncomfortable a bit. I'm willing to express my beliefs because they're worth it. Additionally, difficult conversations are an opportunity to build trust. They're an opportunity to show the person that you're going to have the difficult conversation with that you trust them to handle this vulnerable situation, and you trust yourself to handle the vulnerable situation, their thoughts around the vulnerable situation as well. Ultimately, you feel more connected after having this. And as I alluded to, I think in the beginning, when it comes to difficult conversations, the emotions that it evokes are emotions that our society and we, have adopted on being almost like wrong emotions, or emotions that we should hide, such as feeling embarrassed or afraid or angry. When you're willing to go to the table and have these conversations, you learn that despite these emotions being strong, they're not bigger than you. They're not bigger than the relationship. You don't think that the relationship is so fragile that it couldn't handle those emotions. And ultimately, we do it because we want to improve our relationships, because you want to help someone, as Mindy says. And those are all really great reasons to have the difficult conversations. And as many of you also said, Nancy and Tiffany, they're necessary, and they're necessary to resolve issues. So I like starting difficult conversations with starting internally with myself, understanding where my my stresses around the situation, my thoughts, my emotions, my beliefs. This is one of two aspects of self-awareness as defined by Tasha Eurich. So in knowing myself, let me give an example of this. I know that when I'm having a conversation and someone raises their voice at me, I start feeling a little bit unsafe and uncomfortable. And I notice some of the physical manifestations of this that I notice is my chest starts tightening, my face grows red, and I want to leave, that flight response. And in that conversation, I have to learn to self-regulate. I have to notice what I'm feeling and remind myself that I'm safe, that this other person is just expressing themselves. Yet I'm still safe. Secondly, so that's like kind of just knowing an internal process of mine. The second aspect of self-awareness is understanding how you're perceived by others. And this is often neglected by many of us. In fact, Tasha Eurich found that most people do believe that they are super self-aware, but only 10 to 15% actually meet the criteria. And where they fail most often in meeting this criteria is that external feedback. So, for example, I may have a conversation where I felt like I praised a coworker. And then later I gathered feedback that actually it was perceived as being condescending rather than praising because of the tonality. I would not have known that without actually seeking it out or having a trusted coworker that would come to me and tell me that. So throughout this entire process, starting from the very beginning with self-awareness, it's really important to consult. Consult how you are perceived by your supervisors, friends, colleagues, professional coaches, therapists, trusted family members. A self-awareness assessment from Tasha Eurich's book, Insight, is down below. I'm not sure if you can see my mouse, but it's right there. And it's a really great assessment because it gives you an opportunity to type in your internal evaluation as well as sending it out to external consultants here. So I personally really value that one. Now let's see what happens if in the different quadrants here when you have a different level of external and internal self-awareness. So I'm going to start with the seekers. Seekers have the low internal self-awareness and the low external self-awareness. They don't know yet who they are, what they stand for, or how their teams see them as a result. Or as a result, they may feel stuck or frustrated with their performance and relationships. Often you'll see seekers coming to a difficult or an opportunity for a difficult conversation, and they avoid. And instead of actually engaging in the conversation, they may tell everyone else about it except the actual person that they should have the difficult conversation with. Or when the opportunity arises, they may not be aware enough with what's going internally that they're able to articulate the issues at hand. Moving on to the low external self-awareness and high internal self-awareness, the introspectors here, they're very clear on their own beliefs, their own views. But when they have the conversation, they are often able to articulate their viewpoint really well, but they don't provide that safe space for the other person to share their beliefs. And if the other person does share the beliefs, then they're not listened to. Introspectors will walk away from a difficult conversation. Often feeling like they were misunderstood, and the recipient in the difficult conversation walks away feeling like they're not heard at all. So it's a lose-lose. Then we have the pleasers, who are high external self-awareness and low internal self-awareness. They can be so focused on appearing a certain way to others that they could be overlooking what matters to them. This means that when they have difficult conversations, they're the ones who often give their power away in expense of their own happiness or what really matters to them. And this too is a lose-lose situation, because the pleaser doesn't get what they actually need or want, and the other participant in the conversation doesn't have the opportunity to address real concerns collaboratively. And then we have the person who's more aware. They have the external self-awareness as well as the internal self-awareness. They know what they want, they know what they need, and they seek out other people's opinions. They often provide a safe space to have conversations where they share their views, open up space for the other person to share views, and then collaboratively find a solution that works for both. So we really want to try and be in the high awareness area as much as possible. Sometimes it's harder than others. So, and again, one of the places that most of us lack is getting that external feedback. In addition to self-regulating through self-awareness, compassion, manufacturing compassion for the person in that will be having the conversations, really important. So I'm wondering if, and maybe suffering is a strong word here, but I'm wondering if people in chat can kind of imagine what the other person may be feeling in regards to this difficult conversation. And if you could just share. You can steal some of the words I have here, such as shame, isolation, fear. Just take a moment to put yourself in their shoes. Maybe it's no sense of control, which is a really scary place to be.
One thing that I've noticed in difficult conversations that's helped me in difficult conversations is recognizing that there's always more to the story. That sometimes my perception of the situation can sometimes be worse than what is actually going on. And that's why I like to have these difficult conversations, because it clears everything up. But then with some of the kids or some of the parents that I work with, one of the things that I have noticed with some parents is either they are open to what we're suggesting and what we're thinking about, and then there's some who I don't know if it's shame or just kind of a sense of denial that no, there's nothing wrong with my kid. We don't need to go down this route. Yeah.
Yes, that feeling of I totally understand that maybe there could potentially be shame and shame around the feeling of denial. Like what, well, and I really hadn't thought about the aspect of denial, but I think that's a really great one that you can definitely think about. I didn't actually catch the person's name who was talking. I apologize because my screen's up. But I think that's something to really, and putting yourself in their shoes, experiencing what they're feeling, like the world or other people are telling them something contrary to what they actually feel, which can, as Tiffany says, confusion here. I think that is just a great representation of no sense of control. Let's see what Barbara says. a feeling of inadequacy. Like, yeah, those are feelings really rooted in guilt and shame. And I really love Brene Brown's definition between shame and guilt. Shame is I am wrong, and then whereas guilt is I did something wrong. I think that, yeah, those are really great stepping stones into feeling empathy and compassion for these, or for the people you're speaking with. And then once you find that compassion, the empathy, I often like to take it a step further and in my mind internally, send them a thought as I'm preparing for this conversation, such as I often go to, may you live life with ease. May you offer yourself compassion. And reminding them they're trying their best, like I'm even closing my eyes right now as I do it, because it's something I like to mentally send towards them. And once you've manufactured that compassion, and sometimes you really have to manufacture it, because we know that people can be really, really difficult with us, or for us sometimes, just as we can be for others. The next step I like to do is providing compassion for myself. When you, and self-compassion is when you notice discomfort or stressful feelings around something that's happening in your life, such as the difficult conversation, and then taking it a step further and treating yourself like a good friend. This is a part of the self-regulation process. And I actually would love to do a self-compassion break with you all right now. So I'm just going to ask everyone to kind of in a meditative moment, close your eyes and just bring to mind the difficult conversation that you thought about in the beginning that you need to have, or that you recently had. And notice where you may be feeling tension in your body. Perhaps in your chest, or maybe even tears or waters coming towards your eyes, and acknowledge it as a painful or uncomfortable feeling. And then it's important for us to remember we're not alone in this, that although the situation is unique, that this emotion is a part of the human experience. And next, either place your hand on your chest or give yourself some sort of supportive touch. And ask yourself what you need right now. What do you need to hear? I too am doing my best. I can speak my truth. I can do this. And just let it go. And when you are ready, just come back to the screen. And if you'd like, I'd love to hear kind of how that experience was for you as you're thinking about the difficult conversation. I also know that it also could be a very private thing, in which case you don't have to share at all. I also too know that this tool may not work for everyone, and that's okay. All right. I often notice that I kind of leave thinking about, after my compassion break, I leave thinking like with softer thoughts around the conversation. And once I have used both self-awareness and compassion to regulate my emotions, I start working towards what our previous speaker, what he was alluding to, which is noticing my thought patterns around the situation. What are the facts? See and hear. What did I see and hear? What's the story I'm telling myself? How do I feel about the story I'm telling myself? And then how is this going to impact my actions? So let's actually walk through it right now. So what are the facts? The story or the facts of the situation that's propelling me wanting to have the difficult conversation with my siblings. It began by me sending a couple of texts and emails to my brothers and then them not responding. And the story I'm telling myself is that they're intentionally ignoring me because they are not taking this seriously. They're intentionally, or they're ignoring me because they don't value me, or they're treating me like their little sister, you know? And when I tell myself this story, I just naturally tell myself this story, it makes me feel basically bad, you know, like it makes me feel sad. I don't feel valued when I tell myself this story. It also makes me feel angry because they're not treating me, you know, seriously and my ideas seriously. And it can really work. My story can really make me get worked up. The next step, though, before getting fully worked up, is exploring if there's a possibility this story isn't true. So I'm wondering why you all may think that my siblings are ignoring my, you know, my emails and my text. I can think of many reasons why. And challenging myself. They are busy, Mindy. Yes, they have lives. They each have 3 kids, so they're running around. And they also may have just missed the text and emails. The important part of this is challenging my thoughts. Just because I think it doesn't make it true. In fact, most of the things I think probably aren't true. And once you challenge yourself through that, challenge yourself around the story that you're actually telling yourself, that I like reminding myself, and the reason why I even want to have these conversations again. What are the goals? What do I want out of the conversation? What do I need to be communicated, and what is the mutual purpose? So in my situation, my goal is to make sure that I feel valued as well as my brothers feeling valued in our entrepreneurial efforts. And take a moment to think, what is the mutual purpose behind having the conversation with your client? You want to make sure your client, I can imagine here that you want to make sure your client doesn't feel alone, that they know you're there when, you know, that they know you're there to support them through this process. And once you are able to kind of articulate what your goal is, reach out to the participants and say, this is my goal, and I'd like to meet about it. So for me, I can reach out to my siblings and say, hey, I really want to improve communication before we move forward. I'd like to meet with you. You know, can you give me a couple times? Here are a couple times I'm available. And ideally, it's nice to meet in person or via Zoom, but I know that's not always an option. And when you actually sit down to have the conversation, make sure you start with the facts, and then you can share the story around the facts, and provide an opportunity for the other participants to give their take on the situation. And of course, as you are telling your story, it's really important to make sure you say, in my opinion, or perhaps this is how I interpreted it, and encourage them to provide feedback along the way too. A lot of times these conversations for people, as you well know, can be really intimidating. And so encourage them, say, I would love to hear from you, or what are your opinions or your thoughts around this particular topic? And what are your goals in having this? On the presentation I shared with you all in advance, there are a bunch of do's, but I just want to concentrate on just a couple for the sake of time. When you're having the conversation, make sure you're actively listening and being curious. And as a great skill to active listening is checking to make sure you're understanding what the person's saying by paraphrasing after they've said a statement. So if I'm understanding you correctly, this was your experience of the situation is a way you could phrase it. And also take responsibility of your part whenever is needed. And don't take responsibility for their part, just your part. Just your part is enough. Often too, I find myself, because I'm a chatty person, being tempted to avoid the conversation in general. And so I actually, when I know I'm having a difficult conversation, I really limit small talk because I want to take it back to the main goal of having the conversation. And throughout the process, it's important to continue being compassionate to yourself and others. And if you're at a place where you can't be compassionate to yourself and others, it's okay to take a moment and reconvene and collect yourself. And you can just say, hey, I need 5 minutes. This is more emotional than I thought it was going to be. Or you can say, I need to go to the bathroom. Let's talk about it in just a second. And throughout the conversation, you also need to collaboratively work with the other person to name issues and define the next steps. And then as far as don'ts, again, your list is much larger than my list here being displayed. Don't own the problem. This is both of your problems, and own your part in the problem. And proportionately let them own their part in the problem. Also, if other people's emotions are running high, just acknowledge it. Like, I noticed this is really hard for you to talk about right now. Should we take a break? Or, I noticed that this is making you really sad, and I notice you're crying. Really should. Rather than naming their emotions for them. Do we need to take a moment? And also, going back to that active listening, don't think of what you're going to say next while the other person's talking. I know it totally happens sometimes, and if it persistently happens with me, I'll often just take a side note so I can be present, and I know I won't forget that thought that popped up. Also, don't assume that the other person understands your view on the whole situation without explaining it to them. And don't act out of high emotion. If you need to take a break, you totally can take a break. It is okay to say, I need a couple of minutes. When you're having the conversation, if a feeling of hesitation comes about too, honor it. Again, just ask for time and then get back to them. Also, something I think that's really nice and helps develop trust when having difficult conversations is just by stating, like, I notice you're hesitant right now. Let's take some time. It's we don't have to solve everything right now. You know, maybe you have to solve it by the end of the day or whatever, and you say, just let's take 30 minutes and let's come back, or let's take a week and come back. And if you're in a place at the end of the conversation with the person, it's really nice to reflect on the conversation with them. Like, what went well? Did we meet our goals? What are our next steps? And I encourage that to happen in difficult conversations that feel safe to do so. If that doesn't happen, or no matter what, I would suggest that you take time to reflect independently of the conversation too. So were you proud of the way you managed it? What could change? What do you need to do next? And what could you have improved on? And like, do you feel differently about the person or the problem? I like thinking about difficult conversations as, and then honestly, each conversation I have as practice. Like, I'm not going in to have, I'm not going to be perfect at this. I'm human, just like the other person is, but I'm going to practice my difficult conversation skills. And it just gives me permission and grace to be human. And afterwards, a lot of times I need another self-compassion break, because I look back and I'm like, oh yeah, I wish I would have said that differently. Or, you know, I got really emotional there. I definitely have to take a self-compassion break and remind myself that I did the best I could, that it was a moment of suffering, and that other people completely understand, have been in similar situations. So I know this was a really, really quick presentation, but I'm hoping, as many of you started off knowing already, that everyone's walking away knowing difficult conversations are stressful, but necessary. And when you prepare, you can often, in preparation, you have the opportunity to self-regulate, as well as control the story that you're telling around the conversation to be had. And having compassion for others and for yourself is something I actually hope that is the primary thing people take away, is having compassion for self and others is really important. And then when you sit down to have that conversation, sharing the facts, telling the story that you've been, or how you've interpreted the situation, asking them how they've interpreted it, and talking tentatively, saying, in my opinion, and encouraging the other person to talk. This is a really nice structure to follow for difficult conversations. And then reflecting and learning, because we're all practicing here. Yeah, I think that, well, I'm done with my presentation. If we want to open it up to discussion, if we have time, that's great. I'd love that.
So yeah, we have about 4 minutes if anybody wants to share anything with Katelyn.
We flew through it.
Yeah. So Katelyn, what I really love today, and what as I was thinking about it as you were sharing, I kind of looked at it from a family's perspective today. I thought that Justin's comment with where he's talking with families. I was kind of listening to that and thinking about just another session I was attending in this conference of when families are driven by professionals, how they handle some of that. And I think that thinking about what I heard from the families and then your talk, just kind of thinking about that, maybe I need to have conversations differently with it. Coming back and saying, how are they viewing those things? And how do I let them talk about what their feelings are? Because I may want them to do X, Y, and Z, but I need to maybe realize that that's not where they're at yet. They're still back on, P, and we need to go there. So those were my thoughts. I thought it was really great.
And I like, as you say that, Janelle, I also think about like stakes and how like in a professional setting, stakes can be completely disproportionate, right? The family stakes feel really, really high, and the professional stakes, it would probably seem to be low to medium. And then having compassion in that too, like understanding like, wow, this is this person's child, or, themselves, and knowing that, that they have a more personal, I don't know how to say this exactly, but that this conversation hits on a very, very personal level. And most of the healthcare professionals that I work with get that and do treat it, appropriately, like fragile.
Anybody else have any other thoughts or comments?
I just really appreciate you mentioning again and again to reevaluate what you're doing and learn from it, rather than think of it as a learning experience, rather than, okay, once again, I failed in a crucial conversation. Because I think when you do reflect back on a situation and you really think it through, then I think it gives you, it's almost like you're role playing for the next one. So I think that's really great advice.
Yeah. And I honestly, Barbara, before each difficult conversation I have, I'm like, okay, I'm going to practice difficult conversations again today. And it kind of, it removes, like, I don't have to be perfect in it. It gives me some opportunity to be human. I'm glad that you resonated with that.
Anybody else have any comments? I didn't see any in the chat. Okay, well, Katelyn, I appreciate this. It's a valuable topic, and we always have those. Well, sometimes we always think about crucial conversations with just coworkers or family members. I think that as we're in the healthcare field or in the education field, it's really important to learn those skills and take into the ideas that you shared. I know that as I think about some of the things I have, I'm going to take some of these for my next crucial conversation that I have with some of my families. So I appreciate your time and input.
Yeah, thank you all for allowing me to chat about this. Yeah, and I hope I'm going to actually step out. I have to take my car to be serviced, but
well, great. Hopefully that's not a critical conversation, because sometimes with cars that becomes that too, right?
You know what? I will look at it as an opportunity to practice, but I really don't want to practice it today if I don't have to.
Great. Okay, well, I thank you for joining us. So our case presentation today is going to be done by Barbara Levitt. And today we're going to try something different. Instead of breakout groups, we are going to do the case presentation in a large group. And so Barbara, if you want to go ahead and take it away. Also, after the breakout, not the breakout, the case presentations, I'm going to throw up another poll that before you log off, if you will take the time to do that poll.
Okay, and I just wanted to introduce myself. I'm Barbara Levitt, and I'm with United Way of Utah County, and we hold an initiative that basically functions statewide called Help Me Grow, and it's really information and referral on steroids for young children and their families, because we're a national model, and we provide screenings if they're not available through other areas for parents, and then we also help to triage them into resources or information depending upon the level of their needs. And when Janelle asked me to do this case study, I have been doing some work over the last couple of years I had a couple of social workers that I was working with at the road home, and we did some trainings there, and we were doing some partnering, and I wanted to share a case that they and I worked on a little bit, because I thought it was a really interesting family case that if interventions could have been implemented at the right time, I think there could have been a difference in the outcomes. So bear with me, this is my first case study, so I'm not really sure what I'm doing. Again, we're just re-emphasizing that we are protecting the individual's privacy, and I've changed it a little so that it's not, you wouldn't be able to recognize them, and there's no names used in this. Okay. So the parent, I was working with the family resource specialist, and I also worked with the social workers in the road home, and the parent was currently living in shelter, and the mom was pregnant with her third child. She's 30 years old. She has 2 children who are being raised by relatives they have guardianship, because she had to go through the child welfare system, and she lost custody of those 2 children, but they went with kinship care. And she has found out that she's pregnant, and she would really like to parent this child. So when she lost her first 2 children, she was in her early 20s, probably 20 and then 24, because they're a little bit older. And so she's had a little bit of time, but she's currently in shelter because she's had a history of drug abuse. She's had a history of trauma in her teens. The mom has lost 2 children, and she would like to be able to parent, and she's showing signs to the social workers, more so than the family resource specialist, but she's showing signs of emotional growth and willing to receive help. And one of the things that she did when she did find out that she was pregnant was that she quit cold turkey and started talking to her physician, her OBGYN, about what were the things that she could do so that she could prepare to parent this child rather than just lose it into the child welfare system. So the goals in the family resource specialist and the social workers both really discussing with the mom what her goals were, was that she wanted to be able to parent the baby. She wanted to receive appropriate prenatal care so that she would be doing the best for that baby. She was very, very concerned about that baby, and she wants to secure stable housing. The barriers that she's facing is that the housing, obviously this is everywhere. It's in Utah, it's everywhere. The housing is limited. And because of her inability to secure employment, she's been on and off substances. And so she's had a little bit of a history in housing. So it's hard for her to secure housing. Her family is tired of the cycle of addiction, but are seeing a growth in this mom, and they are kind of have a little bit of a different tune of wanting to help more than they have in the past. She does have an undiagnosed mental health, and she has said many times, or told the social workers and the family resource specialist, that many people have mentioned that she probably does have a mental health issue, but she is very weary of being diagnosed and even more weary of using medication. So she feels hopeful that this round of the pregnancy, she can be clean, and with the housing voucher, she feels strong that she can get the other 2 children back. And she's been through the homeless service system since her first birth, and she is currently up for a housing voucher and is searching for a unit to be approved for. So here's the discussion questions that I would like to have. I'd love to have you unmute rather than the chat, because I think it's nice to have that back and forth conversation. But how can we support the mom in her desire to be successful? And what needs to be in place to see progress? What are the possibilities to having housing options that would support her in her parenting? So not just a place to live, but more of a community. And how can you structure family support without jeopardizing the first 2 children?
So we're just going to go ahead and answer these out loud. Like Barbara said, if you just want to go and unmute, what are some of those things that you guys are having come up based on that? One of the first thing comes to my mind is that you guys have had some of these crucial conversations, haven't you already, Barbara?
Yeah.
In dealing.
Yeah, we did. Yeah. And I think the social workers at the road home are very skilled, and they did a tremendous job in kind of searching through crucial conversations, what some of the issues that were worrying them about putting her into certain situations and into resources because of past history, but also they were able to, out of that, extract this mom's kind of growth, her emotional growth that they've seen. So.
Yeah. And I know that lots of times as an early intervention, we want to say, how can the mom help the child? But really your questions right here are, the mom is more worried about these other things. So she's not even to the point where we want her to be. So what are some things that we would help support mom with those? Where's all of our service coordinators on here? They have fantastic ideas of what to help support mom to be successful in that.
Is there a women's counseling center or anything in the area where she can kind of get some help for herself, and then maybe have another option on parenting type classes so she can work on her and thinking about the future?
Yeah, that's great. I love that suggestion. And actually there's a counseling service that is a women's counseling that's kind of connected with the shelter, and they were able to get her in there. And one of the things they found out was that she did have some pretty severe trauma experiences in her teens. So she was willing to go to a therapist and was working with a therapist on that. So that's great. Thank you.
Jennifer Goldman-Luthi, I'm going to ask you this because you probably know a little bit more. I was thinking about how to connect her with the mom with the super rad, with Marcella's program, even just because she does have that addiction. Is that something that?
Yeah, that's a good question. I know Super Red services women during their pregnancy and after. So outside of that, I'm not as confident.
She is pregnant right now, so
Oh,
would
yeah.
it be okay?
Yeah,
she's
she
pregnant.
She can. We just updated the page, the portal page that goes along with this series, and it's got information for that kind of outreach in there under the service providers. So I'll stick that in the chat.
Oh, I would love that. Thank you.
And the other thing that was coming to my mind also, besides that, just that super rad, I was wondering, has anybody, I know DCFS and Kyla's not on here, but maybe Cody Thurgood, do you have some supports to share with this mom to make sure she's successful in her mental health, or sustaining, that she is not using during this pregnancy? I know Cody sometimes has a struggle unmuting. Okay, must not be unmuting.
Sorry, Janelle, did you say my name?
Yes, I did.
Okay, I couldn't tell if it was my name because I was trying to do something else. So sorry.
That's okay. I just know you know a lot of great resources because there are some concerns around mental health. So are there some places that we could direct Barb to helping this mom find some mental health services to help her be successful?
Yeah, of course. So one of the things, if it's general mental health, obviously, and depending on insurance, if it's in Utah County, Wasatch Behavioral Health is a great option. There's also some really good providers around that do like sliding scale fees and different things like that. But if there's some specific like maternal mental health pieces too, getting connected with that network and the maternal mental health piece would be awesome as well. And then as far as like parenting and mental health, the Children's Center is always fabulous. And they have some great resources for outside of Salt Lake County now as well. So those are some off the top of my head is, our local mental health authority system. And they can also then refer out to their partners as well. And then those other resources as needed.
Is anyone on here from child welfare? I'd be interested to hear if the Family First program would be something that would be available to a mom who could very likely lose another child, but is much more motivated to do the things that she needed to. Because I know there's a lot more funding coming down to surround families before the child is removed from the home.
Hey, Barb, I don't see anybody, but I can speak to that very, very small.
Thank you.
In a small way. There are some great resources around Family First prevention dollars, and they really are trying to get that out more. There's classes, there's specific modalities, there's a lot of things. And one of the exciting things that we're looking at as the Department of Health and Human Services and the Department of Health and Human Services, the new DHHS, comes together is some of that Family First funds we're hoping we'll be able to go towards home visiting as well to help expand that and get some more resources for parents in those prevention realms of things.
That's great. Thank you.
I just have another question for everybody on the call also is, as we're sharing these resources or this information with our families, whether we're in early intervention or in the medical world, how do we make sure that the parents are following up on the resources, or that they've actually connected with the resources? I think that is one way to help support this mom. So I'd be interested to hear how any of you guys do that. Heather, I know you work in the Weber Morgan. What do you guys recommend? Or how do you guys do that? Oh, I can see you talking, but I can't hear you.
Heather's having problems with her laptop mic.
Okay, so I just called on the wrong person right this moment. Megan Israelson, what are some of those things that you do? I know you're in early intervention too, so.
I don't know that I'm very good at following up with families on these things, other than to ask, send an email, a phone call, or ask them at my next visit. I think one of the things I've tried in the past is to make sure that multiple team members know that these are resources that have been shared with the family, so that the follow-up is not only on my shoulders, because I'm very good at forgetting things, but just that there's multiple people that are able to follow up with those families at different times. For me, has been probably the most successful thing that I've done.
That's a good idea. Natalie, I know that you see people just in your clinics. How do you do some of that following up?
I've been thinking, and the only thing I could come up with for this one was, and I'm not an expert on it because my care coordinators are better, but it's called wraparound services.
Would you tell me a little bit more about, or just us on the call that may not know what that means?
Like I said, not the expert. I just know that my care coordinators contact wraparound services. Does anybody, it's called wraparound services, and it is through DCFS, I believe. I'm not the expert. If my care coordinator was here, she would be, but I don't know. I'll look. Let me hunt around and see what I can find.
I know the local mental health authorities have family peer support, which do wraparound supports and look at community supports that are needed, family supports that are needed, and really are great at providing those wraparound services.
And you know what, I was just going to mention too, one of the things that we're working with in Utah County, and I know it's happening up in Ogden area and then down in Washington County, and they're spreading it further with the Unitas platform, where we physicians can tie to community providers. They all have to be on the platform, but then there is an electronic closed loop type of system that's working. And that's been very helpful for some of our clients. And if you have a client that you have no idea where to send them or what to do, they have a coordination center in 211. Basically, it's called Connect Us, and you can send them to that, and they'll have almost like case management out of 211, and they've got a huge directory of services there.
These are great things. I just always like to think about that, because I know that lots of times we provide all these resources, and if I'm overwhelmed because my main goal is that I want to make sure I keep my child, or I'm not sure where I'm going to be living tomorrow, I might not be able to follow through on the resources, even how well just the amazing things that you guys have shared. How do I make sure that that client is following up on it? And that's one of the things that the families in this past call that I was on really talked about, is that I was given all these resources, but I was so overwhelmed, I didn't know how to start. And then I felt guilty because when I went back to see Kurt, I hadn't really followed up on anything.
And I do want to mention with this mom, and I think one of the things that was really interesting is that her family, her parents were parenting and they had guardianship of the two children, but they would have loved to have seen reunification eventually. They felt like they wanted to support their daughter, but they couldn't until she had followed a protocol and a plan to be able to do that. And so I think sometimes we miss the informal or the family supports that could be rallied by a professional so that there's good boundaries and there's good communication and there's that follow-up. So I think that was one thing that we learned from this one.
Yeah. Okay, moving on to that next question. Anybody have any possibilities of having housing options that would support her in parenting?
Is there anything through the Department of Workforce Services, through like an eligibility worker, that they can help them access some different options? There's lots of different things that it seems like that they're able to access through the Workforce Services and their eligibility, besides some of the standard things we think of.
Yeah, that's great. Thank you.
Sorry, and I did find that it's called Systems of Care. It's a Department of Health resource, and it is designed I put it in the chat along with the place to reach that. And if you need a little more help, I do have a care coordinator that would really be awesome at this, but it is super helpful in lots of cases. So I don't know how you qualify for that. That's the problem.
Thank you.
Did you say that she does have a housing voucher already?
Yeah, she's waiting on it. Yes.
I know that when I was getting moved into my apartment, she's involved with DCFS currently?
She is not. She hasn't.
Trying to avoid that.
Yep.
Okay. Well, I was just gonna.
Yeah. Go ahead. I'm sorry.
No, you're fine. I was just, if she was, I know that DCFS they paid for my first deposit for my house. Whenever I needed help with rent, they helped with rent. They helped me with utilities. So that's where I was going with that.
And that's kind of what I was hoping for with that Family First funding, is that especially with a parent who is probably pretty likely to lose the child could go into services, but the mom is pretty motivated to try, to work before it happens.
Right. And I know we have a place down here. I'm in Carwin County. It's called Circles. I don't know if it's similar or if it's statewide. So I'm not real sure on that. And they help with things like that.
Oh, that's great to know. I didn't know that there was a Circles down there.
Yeah. Sue and Kurt, do you remember, so here at the Institute, there's that campaign that's going around for housing for people with disabilities. Either one of you recall that off the top of your head?
So this is Sue. I don't recall that right off, but it's certainly something I could dig into and get to Barbara if it seems applicable. Maybe Kurt recall something more specific.
Yeah, I was just going to say, I know that the Assistive Tech program, Marilyn Hammond wrote a grant around the housing for people with disabilities, but I think it was specific to those who also were affected by COVID. So I'm not sure if that's what you're talking about or if it's something different.
That could have been. I just remember having something come across and was wondering if that would be a resource. Anybody else have any other ideas? Or Nancy, I'm not sure what you do in your everyday job. Do you ever have possibilities about housing options?
I guess you're talking to me.
Yeah.
Not really. I'm a nurse, so I deal mainly with health assessments, and I see NICU grads, and babies with health issues. I know that in our program, we see Salt Lake City proper, and a lot of the low housing, we see a lot of the low housing families. Just because a lot of the low housing apartments are in our area.
So that might be someplace.
Okay.
Yeah.
I was going to say also that to let her know about early intervention before she has the baby, so that she can be ready, because early intervention can help her with her parenting skills after baby's born, can help her learn how to take care of that baby.
That's great.
That's great. Okay, and then our last question is it moved, so I couldn't, but it was to help with
oh, sorry.
That's okay.
I'm sorry, I didn't realize I moved it.
Oh,
one more.
back.
There we go.
Okay, to structure some family support without jeopardizing the first two children. So any ideas around that one? And I don't know if anybody has any follow-up questions they want to ask Barb on that.
This is Cody. I put it in the thing, but I think, the goal is to try and avoid like DCFS involvement. But on the prevention side of things, it could be a great resource with some of these things, and really being able to help support that family as well as help support the other children in that process. And that's where some also the parent-child therapy could come into play for helping kind of support and heal and try and create, that nurturing relationship, and being able to process some of that trauma for the other children as well as helping learn skills for the new child.
Yeah, that's great, Cody. Thank you.
Sounds like that one is a little bit of a harder question to ask. I've also put the poll up, so if everybody on the call could take a minute to put the poll up, take the poll and think about that question.
And one of the things that one of the resources that we did reach out to was grand families, because the grandparents who are providing the kinship care would be supported, and the parent in reunification if that ever became a possibility. So we did reach out to them, and I think that's a good resource. And it's in several different areas. I think it's in St. George now too. It's in Salt Lake and Northern, and then also in Utah County.
So Nancy, you said you are an nurse from EI, right? But you deal with the NICU. Did they have?
Well, it's just not just NICU grads, but I work with early intervention. So I see a lot of the kids in the program just because I do health assessments, as well as having a small caseload.
Yeah, I was just, do you have any things that for family support or structure for NICU? That's a pretty stressful one too. I was wondering if there was any resources you had that might help this parent.
I know there's support groups for parents whose babies are in the NICU. As far as we usually get them after they're discharged. So the parents have already been through that whole stressful period, which is traumatic. Even if it's just a short period of time, it can be traumatic from personal experience.
Yeah.
Please.
Any other ideas or thoughts? Okay, well then we will go ahead and wrap up. If you could look over the poll and the questions, that would be great.
Thank you for all the suggestions. I appreciate it.
Great job, Barbara. You're awesome.
Thank you.
Thanks, everyone.